Yes. Okay, we'll go ahead and do that. Bye-bye. Lupe, be sure to check on Mrs. Lopez. We haven't moved her to the new wing yet.
Sure. I was just on my way to go see her.
I will tell her good morning for me. She's such a sweetheart.
She's such a character.
Is that right?
She gives me such a hard time when I try to get her to brush her teeth. She never runs out of excuses.
She's so funny. We'll see you later.
Bye-bye.
Okay. Lupe,
Hi.
I'm glad I caught you. I'd like to introduce you to Dora Vela, our new nursing assistant.
Welcome. I'm Lupe Garza.
I'd like Dora to go with you on your shift. She knows what type of personal hygiene we give our residents, and I'd like to give her a chance to observe.
Sure. I'll fill you in as we walk.
I'll see you later, Dora. I'm leaving you in good hands. Thanks, Lupe.
Bye-bye. The first thing that we'll be doing is providing oral hygiene. Wait a minute, Dora. I meant to pick up the dental model for Mrs. Lopez. Consuelo, I forgot to ask you for the dental model for Mrs. Lopez.
No problem.
Ever since her stroke, she's had to learn to do everything with her left hand. Oh, she can brush independently with some encouragement. She's fussy but cooperative.
Here you go.
Thanks.
You're welcome.
There'll be 2 other patients that we'll visit besides Mrs. Lopez. Mr. Richards, who is unconscious and totally dependent, and Mrs. Guerra, who needs help with denture cleaning. Now, in Unit 2, we'll visit Mr. Pina.
Escuelas públicas que están ahí.
Pues muy bien, figúrate.
Good morning, Mrs. Lopez.
Nothing good about it as far as I can see. You're 10 minutes late, and as thorough as you are, I probably won't see you on my TV show. Who's that with you?
This is Dora Vela.
Good morning.
Good morning.
She's our new nursing assistant. She's following me this morning to get a hang of things. Do you mind if she stays and observes?
No.
Good. Why don't you wheel over to the sink while I gather everything that we'll need to help you brush your teeth?
Here, I'll help you.
Don't know why I can't just rinse with mouthwash and leave it at that.
Mrs. Lopez, that would be like using perfume instead of taking a bath.
Such a fuss. They put me through this 3 times a day. Brush, rinse, even flossing once a day. Won't let me skip a step. Even make me brush my tongue, and they make me do it.
She's my star pupil. She does a great job.
Says who? I'm not even sure I'm doing it right.
I'll tell you what. I'll brush these, and you can copy me. But first you need to put some toothpaste on that brush of yours.
I bet you do it.
Remember, it's important to aim your brush at the gums and to massage gently using a back and forth motion. Start to brush from one side of your mouth and work your way to the front surfaces of all your teeth. Angling the toothbrush helps remove the plaque, the sticky film that collects in your mouth, especially at the gum line. Your turn, Mrs. Lopez.
Like this?
Great. Brushing your teeth and gums is such a simple way to help prevent cavities and gum disease.
You know, Lupe, I was surprised to learn that as we grow older, we become more cavity-prone than when we were children.
Do you remember why?
Oh, who can forget Mrs. Moreno's lectures? If the gums recede, they can no longer protect the roots from decay, and
medication and disease reduce the flow of saliva, which is needed to protect the teeth from decay. Finished with the front surfaces? Now we can do the back sides of your teeth. Holding the brush the same way until you reach the back sides of your front teeth, turning it vertically like this in the front makes it a little easier to clean this area and reach the gum line.
You'd think I'd know how to hold a toothbrush after 70 years without being told? Like this?
Great! Now do all the back sides and then do all the chewing surfaces. Remember, it's important to establish a routine so you don't forget to clean any of your teeth and gums. Now don't forget to do your tongue. Remember to reach as far back as you can stand it without gagging. Brushing helps remove plaque that sticks to your tongue, and it also freshens your breath, and it even improves your sense of taste. You've done a great job, Mrs. Lopez.
Good. Now you can do me the favor of leaving my room so I can watch my TV show.
Not so fast. We're not finished yet.
Brush, floss, rinse. I told you, she never lets me forget a step.
Just because you brushed doesn't mean you've cleaned every part of each tooth.
She's able to floss her own teeth.
She can with this special holder that allows her to floss with one hand. This floss holder also makes it easier for us to floss the residents' teeth who can't do it themselves.
Don't you have problems when the floss is too loose?
No, let me show you this threading trick I've learned. If you squeeze the prongs while you're threading, the floss will remain nice and tight. Okay, Miss Lopez, are you ready for a review on how to floss?
Yes.
First, you ease the floss between your teeth, and then you slide it up and down against the teeth surfaces. Flossing helps clean.
In between your teeth and below the gums. You don't think I listen to you when you talk? And I go all the way around from tooth to tooth, just like brushing.
As soon as she's finished, I'll ask her to rinse off with this mouth rinse that the dentist recommended. All right, Miss Lopez, last step. Rinse, and then you can watch your favorite TV show. I bet you didn't miss much.
Better not have all this fuss about brushing teeth.
Dora, will you clean her partial while I do a quick oral examination on Miss Lopez? May I see how you did?
Sure.
You didn't miss a single spot. Now let me check for any redness, lumps, or bumps. You fuss so much about flossing, but your gums aren't bleeding anymore. Now admit it, Mrs. Lopez. Doesn't your mouth feel great?
My mouth does feel a lot better, but don't tell her. Brush, floss, rinse. Brush, floss, rinse.
Well, Dora, we're just in time to turn Mr. Richards. There, Mr. Richards. While I'm here, I'm going to clean your mouth. Let me position your head a little better so you won't choke. There we go. We don't want to get any fluids in your lungs while I brush your teeth.
Do you want me to make a mouth prop?
Thanks. I learned the hard way you don't use your fingers to keep someone's mouth open. Mr. Richards, your lips are dry. So before I start, I'm going to put some Vaseline on them so they don't crack. With this NG tube in, you have to breathe through your mouth, and it gets so dry. I know you can't tell me if it hurts, so I'll just be very careful.
Does the toothpaste make it hard to see what you're doing?
Regular toothpaste would, but children's toothpaste doesn't foam. Mr. Richards, I'm going to open your mouth and start to brush from this side first.
Why are you using a brush instead of a swab?
Dr. Rodriguez insists that we brush. He says swabbing cleans soft tissues but can't remove plaque from the teeth. Mr. Richards, I'm going to open your mouth a little wider so I can get to the back surfaces of your teeth and gums.
Why aren't you using a swab now?
Dr. Rodriguez warned us that lemon glycerin swabs should never be used. They make a dry mouth even drier. Mr. Richards, I'm going to clean the rest of your mouth and wipe away any excess toothpaste. Good. Time to floss. I'm easing the floss between your teeth, and I'm sliding it up and down against each tooth. Mr. Richards, I'm going to put some more Vaseline before I do an oral inspection. The dry spots are healing. This moisturizing gel the dentist recommended is really working. Half done. Mr. Richards, I'll have to reposition you so we can get to the other side. Dora, do you see how healthy his mouth looks, even though he has an NG tube in?
It's amazing. I expected to see more crust on the tongue and cheeks.
I know. It's remarkable how routine oral care can make such a difference. Thanks. Mr. Richards, I'm off to see your very good friend, Mrs. Guerra. We'll see you later.
You know, Lupe, I know we're taught that unconscious residents may still be able to hear, but don't you feel a little silly speaking to someone who can't respond?
I used to, but then I try to put myself in their place. Wouldn't you appreciate someone treating you like a person? After a while, it becomes natural. Here we are, Mrs. Guerra's room. I wonder if Olivia's visiting.
Who's Olivia?
Her daughter. Good morning, Mrs. Guerra.
Good morning.
I'd like you to meet Dora Vela. She's our new nursing assistant. She's observing this morning.
Very nice to meet you, Dora.
Thank you.
Well, you ready to get your dentures cleaned?
I sure am.
Dora, could you get me the emesis tray, a towel, and Mrs. Guerra's mouth rinse? Anything interesting in the newspaper today?
Same old thing.
Mom, it's me. Oh, I'm sorry. I didn't mean to interrupt.
No, please come in. I was just about to clean your mother's dentures, but I can return some other time.
Lupe, there's no need for anybody to leave. Olivia can sit right here while you do your thing. It won't be the first time she's seen me without my dentures.
I won't say a word. You won't even know I'm here.
Don't believe that. I've never known her to be quiet.
Oh. Mrs. Guerra, may I take your dentures out now?
Let me see how you do that. I never did get the hang of it when Mom was at home.
I told you she'd jump in no time. Biggest busybody there ever was.
Okay, the trick is to break the suction. To do that, you hold the front teeth with your thumb, index, and middle finger, and you tip the dentures back and forth until the suction is broken. Once you do that, see how easy it is to remove them?
Wow, B.
The lower denture doesn't have as much suction and is easier to remove.
No wonder I used to have so much trouble. I used to just yank on them. I always thought there's got to be an easier way. What are you doing now?
I'm checking to see if there's any sore spots or redness that could be signs of infection. No, everything looks good. But your mouth looks a little dry. Dora, could you make a note of that? I need to let the nurse know about the dryness. Also, I wonder if there's been a change of medication that could be causing this. Also make a note that there's a chip in the upper denture.
Well, are you going to clean her dentures now?
No, I'm going to clean her mouth before I clean her dentures. And to do that, I use a gauze or a sponge on a stick. It really doesn't matter which. The important thing is that you dampen it, whichever one you're going to use, so it doesn't tear the tissue.
What in the world are you going to do with that toothbrush? Mom doesn't have any teeth.
I use the brush to clean your mom's tongue.
Brush her tongue? I've never heard of such a thing.
Brushing helps reduce bacteria in your mom's mouth. It also freshens her breath. Dora, why don't you begin to clean her dentures while I finish with Mrs. Guerra?
Careful you don't go carrying those dentures out of the room. Mom lost a good set of dentures here a while back.
Your mom's dentures are clearly marked. There's no chance for a mix-up. See?
Better not drop them or we'll end up having to buy a new set.
Don't worry. That's why I'm going to clean them over this basin. If I do happen to drop them, the water in the towel will act as a safety net. We try to be very careful here.
Why are you rinsing them?
Well, there's two good reasons for rinsing dentures before you brush them. Rinsing helps remove bacteria and saliva. Without saliva, they're less slippery, which means I'm less likely to drop them.
I never understood the sense of brushing Mom's dentures. Seems to me all you have to do is rinse them and douse them in mouthwash so they can taste good.
Well, dentures get plaque on them, same as teeth do. Have you ever cooked oatmeal and let it sit in the pot for a while?
Sure, lots of times.
Well, then you know that the longer you leave it in the pot before you wash, the harder it is to clean. The same with plaque. If you don't remove it while it's still soft, it will get so hard that brushing alone can't remove it. Removing plaque daily saves the expense of having a professional do it.
Are there any special tricks to brushing?
No, not really. You just need to be sure to get all the surfaces. The flat side of the denture brush is designed to clean the outside surfaces, and the pointed part for the gum side because it's harder to reach. There. Now, if your mom was getting ready for bed, we'd fill her denture cup with clean water to store her dentures for the night.
My sister Magda swears that her dentures shrank overnight. She always tells Mom to wear her dentures to bed.
Oh, Olivia, that's bad advice. Storing them in water keeps them from shrinking. And besides, going to bed with your dentures in would be like sleeping with your shoes on. You have to give your gums a rest. There we go. Someone will come back later tonight to help you take out the dentures.
Thank you, dear.
Don't go running away. I have some nice pan dulce.
That's very sweet of you, but we have more residents to visit in Unit 2.
Mom?
No, not now, honey. I'll save it for later. Now my mouth feels so good and clean.
Suit yourself.
You know, Olivia wouldn't let me leave without taking a piece of pan dulce, I can say.
Lupin, Dora.
Oh, hi.
Well, Dora, how's it going?
Great. I think I'm catching on to the routine. We left some notes at the nurse's station. Mrs. Lopez's gums are looking much better, and Miss Guerra's mouth looked a little dry, and someone needed to check on her dentures.
Thanks. We'll take care of that. Oral hygiene is so important to the total health of our residents. We count on you to help us provide the best care. Welcome to the team.
Thanks.